So today I'm going to discuss about a malabsorption syndrome. So malabsorption is a very high yield for USMLE, right? So we will discuss the causes, diagnostic test, and the mnemonics for malabsorption. So before discussing the each pathology related to the malabsorption syndrome, first we discuss about the physiology. So this picture shows the typical anatomy of the GIT system. So it will start from the mouth and end at anus, right? So we will take food from the mouth, and this food pass through the esophagus, then into the stomach, then small intestine, and large, and then finally excreted through the anus. So what happens when food reaches the stomach? So the digestion of food take place in the stomach. So this digested food that I am highlighting in here, it will be observed in the small intestine. Small intestine has a three parts: duodenum, jejunum, and ileum, right? So, so malabsorption basically impair mainly the function of the small intestine. So small intestine, the function of small intestine is absorption. So absorption in malabsorption syndrome is impaired, right? So now I'm going to discuss about the more detail. So small intestine has a three parts: duodenum, jejunum, and third part is ileum, right? So iron, that is observed in the duodenum, iron. Jejunum, B9, vitamin B9, that is a high yield. Ileum, vitamin B12, right? So if the problem in the absorption take place, so it will impair the absorption of these nutrients, right? So nutrients divide into, again, carbohydrates, fat, and protein, right? So if the fat malabsorption take place, it will lead to steatorrhea, fatty stools that are difficult to flush, and it also lead vitamin A, D, E, K. Why? Because they're fat soluble vitamin. If the fat is not observed, it also lead to vitamin A, D, E, K deficiency, right? So carbohydrate malabsorption cause osmotic diarrhea. A typical example is a lactose intolerance. We will discuss the lactose intolerance in details. Protein malabsorption lead to muscle wasting and edema, right? So Sudan test, basically it is a stain that dye the fecal fat, right? So if the fecal has a more fat, then this stain is positive. What is the meaning of Sudan stain positive mean? Steatorrhea. Steatorrhea mean malabsorption of fats and lipid. Xylose test. So that is very important as high yield as well. So xylose test is basically for carbohydrate. It is a carbohydrate. It is for used for the carbohydrate, right? So we give the patient xylose, and if the xylose is observed, then it means the pathology is pancreatic, right? If it is not absorbed and it is excreted, then it means the pathology is a basically mucosal pathology, right? That include celiac disease. So very important. So xylose test is positive in celiac while it is normal in pancreatic pathologies. Pancreatic pathologies that lead to malabsorption, that will be the pancreatitis and cystic fibrosis. So now we're moving toward the celiac disease. Before moving toward the celiac disease, first we will discuss about the pathophysiology of the celiac disease. So this is the normal villus of intestine, small intestine. So, so this is a villus atrophy that take place in the celiac disease, intraepithelial lymphocytes, and crypt hyperplasia. So this is a pathophysiology. When we take gluten diet, so it is digested into the gliadin. Then this gliadin it taken up by enterocytes. So this enzyme, tissue transglutaminase, deaminate this gliadin, right? Since this deaminated gliadin is normally is eliminated, but what happened in the celiac disease, this deaminated gliadin is taken by antigen presenting cells, and this antigen presenting cells present this deaminated gliadin to the T cells, and this T cell activate the B cell, and it will produce anti-tissue transglutaminase antibody, anti-deaminated gliadin, anti-endomycin. So this autoantibodies will start damaging the villus, and it will, in this way this will lead to the villus atrophy, crypt hyperplasia. These kind of the histological finding you will find in the celiac disease. Now I'm moving to the celiac disease. So celiac disease is basically gluten sensitive enteropathy, also known as a celiac sprue. So it is autoimmune because the autoimmune antibodies are present, right? So gluten protein found in the wheat, barley, rye. So it is associated with HLA-DQ2 and DQ8. It's primarily affect the duodenum and proximal jejunum. It is a very important because tropical sprue has a similar uh, thing. It also tropical sprue also damage the distal duodenum and proximal jejunum, right? So this will damage malabsorption and steatorrhea. As we already know that the duodenum, the iron absorbed in the duodenum, so patient may present with iron deficiency anemia, right? And proximal jejunum, so it may present with the B9 deficiency, but most commonly the iron deficiency anemia. And the and associated are extraintestinal thing related to the celiac disease, that is a dermatitis herpetiformis. That is a pruritic. It is a pruritic papillovesicular papillovesicular lesion on extensor surface. That is a very high yield on extensor surface. So dermatoherpetiforms is treated by a dapsone. That is again important. So decrease bone density. Why? Because fat malabsorption that will lead to vitamin D deficiencies. So decrease bone density, iron deficiency, anemia, moderately increased risk of the malignancy, that is a T cell lymphoma. So we already discussed about the D-xylose test is abnormal in the celiac disease because it is a mucosal pathology. So serology, IgA anti-tissue transglutaminase, anti-endomycin, and anti-deaminating gliadin peptide antibodies. Histology, loss of villi, mucosal atrophy, crypt hyperplasia, and intraepithelial lymphocytosis. Next is a lactose intolerance. So lactose intolerance is a basically an enzyme deficiency. So in this lactose intolerance, normal appearing villi, except when the tips of the injury of the villi take place in the viral enteritis, right? So it will lead to the osmotic diarrhea. Lactase is a carbohydrating digesting enzyme, right? So if it is not present, it will lead to carbohydrate malabsorption, and it will, so this lactose remain in the gut, and it will osmotically attract the water, and it will lead to the osmotic diarrhea, right? So decreased stool pH, because colonic bacteria fermentate this lactose, right? So this fermentation leads decreased stool pH. So lactose hydrogen breath test is positive in lactose intolerance. That is a very high yield. So for lactose malabsorption, if the post lactose breath hydrogen value increase more than 20 compared with the baseline, that is a positive, and it will suggest that the patient has a lactose intolerance. So pancreatic insufficiency. So pancreas, as we already know about that, the high yield stuff, D-xylose is normal, right? So D-xylose is basically the test that check differentiate the mucosal pathology from non-other pathologies, and it also assess the carbohydrate absorption, right? So pancreatic insufficiency, pancreatic malabsorption due to the pancreatic pathology due to the chronic pancreatitis, fibrosis, obstetric cancers, right? And cystic fibrosis. So causes of malabsorption, again, fat and fat soluble vitamin, AD, EK, as well as a vitamin B, decreased duodenal bicarbonate, and fecal elastase. So next is tropical sprue. So tropical sprue has a similar finding as a celiac sprue, that is a celiac disease, but it respond well to the antibiotic, right? This is a very high yield. So its affect duodenum and jejunum mainly. So celiac disease is also affect the duodenum and jejunum, but with the time it can involve the ileum as well, right? So it associated with megaloblastic anemia because the jejunum is a site for absorption of the folate, and the ileum is a site for absorption of the vitamin B12. So if these things are damaged, it will lead to the deficiency of the vitamin B9 and B12, and it will manifestation of the megaloblastic anemia. So, so cause is unknown for the tropical sprue seen in resident or recent visitor to the tropics areas. Last is the Whipple disease, that is a super high yield. So it is a infection with the Trophirium whippleii, that are intracellular gram positive organism. So pass positive foamy macrophages in the intestinal lamina propria. So pass the foamy whipped cream in can. So this is a very high yield mnemonic. C for cardiac, A for arthralgia, and N for neurologic, right? So neurological symptoms, three things: can, cardiac, A for arthralgia, and for neurological symptom. So diarrhea and steatorrhea occur later in a disease course, most common in older males.